Welcome everyone to Mended Hearts and our program on the connection between Alzheimer's disease and the heart. I'm Laura Kinley. I'm the program committee chairperson this year, and I'm so glad so many of you wanted to find out about Alzheimer's disease. Being part of the program committee has given me a chance to research and learn and sort through the volumes of information there are about so many of the body's conditions. And in fact, in this year's topic survey that we did at the end of the year, learning about Alzheimer's was the most chosen topic. And it was also the #1 topic in 57% of the surveys. So help me out. What kinds of things are you hoping to learn in this segment of the connection between Alzheimer's and your heart? Jill, go ahead.
Mine might be a little different. My husband, who's young, got Alzheimer's. So I'm doing everything now. I'm keeping the family together, the trust, everything. So I'm on an overload. My mind is going sharp and fast constantly.
Wow.
Yet he's got the disease and I've support groups for that. So
Wow.
a lot.
There is, have you found the Alzheimer's Association?
I'm in several support groups. I'm from Florida here a year and a half ago. I'm in groups there with 6 people. We're close. And also now finally, I've been in California a year and a half and I have 2 support groups out here that are fantastic. So finally, I feel like I have friends now through that. It took a year and a half. So I'm glad to be here.
Well, congratulations for finding that resource. It is, I would love to talk to you about it later because it looks like it is just phenomenal. And I hope we can adopt some of those things that it's doing. So that's good. All right, practice. Raise your hand, click on the reactions and click the raise your hand if you have a friend who has dementia of some kind. 2, 3, 4, 5, 6. Kathleen, do you get 6?
I get 7.
7. Okay. Okay, lower your hand and then raise your hand if you have a family member who has dementia. So Jill, this would be you, of course.
My husband, yeah.
Yeah, 1, 2, 3, 3. Okay, thank you. Your husband, and it would be my mother, my father, my 2 grandmothers. So I'm part of Mended Hearts because I had something wrong with my heart, and now we learn that heart disease and Alzheimer's are connected. But then we found out that everything is connected to our hearts, our feet, our mouths, our lungs, our kidneys, everything. So I take away from that if I take care of my heart, I'll also be taking care of my brain. So I'm gonna hold that thought and see what some of this information that we're going to learn has to say about that. We'll look at Alzheimer's disease, or AD, through several lenses. What does current wisdom say might be the key to beating dementia? What does this disease do to the brain? What do we think causes it? What do we think are the risk factors for getting it? And what is it like to have it? We'll be looking at 3 short videos from different sources and then one from the Alzheimer's Association on the 10 warning signs of Alzheimer's and what to do next. Jill, have you seen that one?
No, I don't think so.
Okay, I would love to have your opinion later about it just to see what you think. Okay, first we're going to go to Australia and hear a news report. There we go. So do you see it?
Yeah, I see it.
We all see it.
Okay.
Yes.
We don't hear it.
No,
Yeah,
we have
okay.
to, someone's got to click the start button.
Yeah, okay, here we go.
61-year-old Yoni knows the importance of regular exercise and good diet. You feel good when you're outdoors as well. Still, the grandmother of 4 is concerned about her cardiovascular health. Yes, was recently looking at my cholesterol. According to a new study, making healthy lifestyle choices when you hit middle age is vital. A 35-year-long study by Oxford University and the College of London involving 10,000 people found in your 40s and 50s, if you focus on exercise, healthy eating, quitting smoking, cutting down salt and keeping the brain active, you could ward off dementia.
Heart health and vessel health is closely related to dementia.
That's confirmed by a second study directly linking the heart's effects on the brain. As heart arteries stiffen, there's lower blood supply to the brain, reduced connections in the brain, and worse memory.
Really, this study is adding to the knowledge that it's a lifetime risk.
More than 400,000 people in Australia suffer from dementia, and it is the second biggest killer in people over the age of 75.
The foundations for dementia are actually laid in midlife. So it's really important to be exercising.
The message is to beat dementia, remember to be healthy. Samantha Brett, 7 News.
YouTube Music Premium.
Okay, so what is that? What connections did this news segment say connect the brain and the heart?
Well, I would say that the more you exercise, the stronger your blood vessels, arteries, and capillaries are. And the better they are, the better the blood is going to flow through your system. And to the degree that the blood stops flowing smoothly through your system, there's a greater risk of Alzheimer's. That's what I took from it.
Okay. Anyone else? Yes.
Sally?
I'm wondering if being on blood thinners helps prevent it, because I have a genetic clotting disorder and I'm on blood thinner injections daily for 15 years. Does that keep me from getting it, I wonder? I don't know.
According to what we heard with the, it says the arteries or the heart arteries stiffen, which lowers the blood supply to the brain. So if you are keeping your blood moving, I think that would be a good thing. It also said it reduces connections in the brain and worsens memory. Now, I would love to know more about those 2 studies. Like, what were they doing? The number of participants, how long did they run? To learn more about that information that they're passing along to us in this quick news study. So that's Sally, can I get back to you?
Sure. Oh, now, yeah, I was just going to say I think it mentioned diet. It specifically mentioned salt, watching your salt. So, which of course affects blood pressure, but both of those things are just key to like building the healthy and strong heart and brain and being functional in all the major organs. So preventive care with good diet.
Okay, yes, I heard that.
Yeah, good point.
Let's see, Sherry's got her hand up.
No,
Oh, not really? Okay.
no.
You might,
Why am I, does it look like it? No. Yeah.
you could lower your hand. How about Jill? Is that a
Yeah,
question?
yeah, I mean, my husband, he's healthier than me. He watches his salt, exercises, walks, miles every day. And yet, the reason he got Alzheimer's, along with several other friends from back in Florida, cardiologists, doctors who are very health conscious, they all got Alzheimer's. For some reason, everybody's getting it lately, and they're young, very young.
Jeez. Very interesting, because this is the sort of things that we need to keep in your mind. We don't know enough yet. Okay, on to Anne.
I was just gonna say, in that piece, they also mentioned quitting smoking.
Mhm.
And that I know affects your blood vessels as well.
Okay. Good. I'm glad you picked up some stuff from that quick little news thing. Now let's go to Khan Academy. They created one of the study courses that's used by the American Association of Colleges of Nursing. And they are explaining the risk factors for dementia and has divided these risk factors into factors out of your control and those under your control. And it makes the connection between the brain and the heart a bit better.
Sally, do you have a question?
Oh, no, I don't.
Okay.
Thanks.
Well, you can see it, but I can't. That's just so irritating.
We need to hear it.
Gives you complete control
Yeah,
of your
to
music.
start it.
So you can listen ad-free, download music for offline play, and keep your songs playing in the background. Get YouTube Music Premium.
Okay, skip the ad. Skip the ad. No,
We need to play.
no. Sorry. Let's. Oh, if you hit the wrong one, then suddenly you've gone on to something else. Okay.
Well, I compliment you on your technical skills. I don't think I could do what you're doing.
I can't.
Wait till I actually do it.
You did it once, that's better than me.
Oh. Okay. We'll go here and then we'll go back.
61-year-old Yoni knows the importance of regular exercise.
When something
Okay, that's what I want. And now what are you seeing on the screen?
You.
You.
Just me?
Everybody.
We're seeing everyone's image,
Okay,
The gallery view about everybody.
right?
okay. So, go to. Let's share. So now what do you see?
Now it's black.
A black screen.
Black video,
Yeah.
Okay,
black screen.
that's a happy thing. All right.
increases the chance that you'll develop a certain disease, we call it a risk factor, right?
So you see Khan Academy?
When
Yes.
something
Yes.
increases the chance that you'll develop a certain disease, we call it a risk factor, right? Because essentially it increases your risk or puts you at a higher risk for developing that disease. By far, the most common risk factor for Alzheimer's disease, vascular dementia, and other types of dementia is age. Dementia is very rare in people under the age of 65 years old, but becomes very common after age 80. Unfortunately for us, the fact that we age over time is a risk factor that's completely out of our control, right? Even more unfortunately, the reason as to why this risk of developing dementia increases as we get older is mostly unknown.
Jill, how old is your husband?
Well, when he first got it with symptoms, he was still practicing law, but he had short-term memory loss. I'd say it was more like around 64 or maybe a year or two sooner, but he was still functioning really good.
Good, okay, just checking.
Okay.
And another risk factor that tends to be mostly out of our control is family history. So here's you, here are your parents, here are your brother and your sister, and here's your child. If any of your family here has developed dementia, let's say Alzheimer's disease, because that's the most common, then you're going to be at a higher risk for developing the disease yourself. So say someone else in your family also has developed Alzheimer's, then the risk of you developing Alzheimer's grows even more. And this can be the result of environmental factors, like how or in what setting you were raised, since it's probably going to be a similar setting for your immediate family, right? And with Alzheimer's in particular, scientists are well aware that specific genes are involved. Even further, Alzheimer's disease has both what we call risk genes and deterministic genes. Now, risk genes are defined just like a risk factor. If you have this specific risk gene, then you're going to be more likely to develop a certain disease. But you're not necessarily going to develop it, you're just going to be at higher risk. So the risk gene that scientists have found to have the strongest association with developing Alzheimer's disease is called apolipoprotein E4. And a lot of times you see it shortened to APOE-E4. This APOE gene helps us make molecules called lipoproteins, which help carry fats and cholesterols through the bloodstream. Maintaining normal levels of cholesterol is very important for helping to prevent a variety of disorders. Now, there are 3 slightly different versions to this gene, also called alleles. You have E2, E3, and E4. And it's the E4 type that increases your risk of Alzheimer's. So if you were to inherit 1 copy of this allele, you'll be at a greater risk for developing Alzheimer's. And if you inherit 2 copies, you'll be at even greater risk. It's been suggested that this gene is a factor in about 20 to 25% of all Alzheimer's cases. So that's the major risk gene, right? Deterministic genes, on the other hand, directly cause a particular disease. In other words, it determines that the disease will be present and essentially guarantees that anyone that inherits it will develop the disorder. As applied to Alzheimer's disease, this is called familial Alzheimer's, or sometimes early onset Alzheimer's, as it can often happen before age 65. Now, scientists have discovered that this can be caused by a mutation in at least one of 3 genes. You could have a mutation in amyloid precursor protein, or APP, presenilin 1, or PS1, or presenilin 2, or PS2. When any of these genes are mutated or altered, large amounts of amyloid plaques tend to build up, and these are a major component of Alzheimer's disease, right? Fortunately, though, familial or early onset Alzheimer's resulting from a deterministic gene is very rare. And there's also some evidence to suggest that those with Down syndrome have an increased risk for developing Alzheimer's disease, because Down syndrome occurs when someone has an extra copy of chromosome 21 in every cell, which means that many of the genes in their cells have 3 copies instead of the usual 2. And that includes the amyloid precursor protein gene. Although not still fully understood, it's thought that this extra gene might account for an increased production of amyloid plaques and therefore increase your risk for Alzheimer's disease. Now, some of the risk factors for dementia and Alzheimer's, however, are, in fact, in your control. Many experts are starting to reveal trends and clues that start to hint at other lifestyle and wellness choices that can have a significant influence on your risk of developing dementia. And one big risk is head trauma. And there's a very strong link that exists between head injury and dementia later on in life, especially when the trauma is repeated, like in high impact sports like football or soccer, or when loss of consciousness is involved. With that said, protect your brain. It's really important. And another risk factor is actually heart trauma. Scientists and health professionals are continuing to see links between brain health and heart health. Many of the risk factors that lead to heart disease also apply to dementia. But why is that? Well, most types of heart disease, your heart gets less efficient at pumping blood, right? Well, if less blood's getting to your brain, it's going to have an increased risk of damaging your brain cells and developing some sort of dementia. So things like poor diet and obesity, diabetes, smoking, and heavy alcohol use will increase your risk of both heart diseases and dementia. And if there's some sort of heart conditions that already exist, like atherosclerosis or high blood pressure, your risk for dementia increases as well. That being said, protect your heart. It's also important.
Hey. So what is not under your control? 3 things.
Genetics.
Genetics,
Rena? Rena, did you want to say something?
I did.
Oh.
Genetics.
genetics, okay. And then age and
yeah.
family. Just whether they're genetically or not, if there's someone in your family you know or don't know about
Family history, yeah.
that has it, yeah. And so what is under your control?
Head trauma,
Yeah.
Lifestyle.
Lifestyle, yeah.
poor
And
diet,
things for your heart.
Right.
Okay, so
high blood pressure.
yes. All right, moving right along.
Sherry, do you have something to say?
Smoking.
Smoking, yes. Now we are going to wait, we don't want risk factors. We want 10. Okay. What do you see on the screen?
Head end.
Okay. All right. Now, a lot of that other one got kind of technical. Remember, it's for nursing students. So, but we will get back to you on some of those other, the apolipoprotein. But
Every 4 seconds, someone is diagnosed with Alzheimer's disease. It's the most common cause of dementia, affecting over 40 million people worldwide. And yet, finding a cure is something that still eludes researchers today. Dr. Alois Alzheimer, a German psychiatrist, first described the symptoms in 1901, when he noticed that a particular hospital patient had some peculiar problems, including difficulty sleeping, disturbed memory, drastic mood changes, and increasing confusion. When the patient passed away, Alzheimer was able to do an autopsy and test his idea that perhaps her symptoms were caused by irregularities in the brain's structure. What he found beneath the microscope were visible differences in brain tissue in the form of misfolded proteins called plaques and neurofibrillary tangles. Those plaques and tangles work together to break down the brain's structure. Plaques arise when another protein in the fatty membranes surrounding nerve cells gets sliced up by a particular enzyme, resulting in beta amyloid proteins, which are sticky and have a tendency to clump together. That clumping is what forms the things we know as plaques. These clumps block signaling and therefore communication between cells, and also seem to trigger immune reactions that cause the destruction of disabled nerve cells. In Alzheimer's disease, neurofibrillary tangles are built from a protein known as tau. The brain's nerve cells contain a network of tubes that act like a highway for food molecules, among other things. Usually, the tau protein ensures that these tubes are straight, allowing molecules to pass through freely. But in Alzheimer's disease, the protein collapses into twisted strands or tangles, making the tubes disintegrate, obstructing nutrients from reaching the nerve cell and leading to cell death. The destructive pairing of plaques and tangles starts in a region called the hippocampus, which is responsible for forming memories. That's why short-term memory loss is usually the first symptom of Alzheimer's. The proteins then progressively invade other parts of the brain, creating unique changes that signal various stages of the disease. At the front of the brain, the proteins destroy the ability to process logical thoughts. Next, they shift to the region that controls emotions, resulting in erratic mood changes. At the top of the brain, they cause paranoia and hallucinations. And once they reach the brain's rear, the plaques and tangles work together to erase the mind's deepest memories. Eventually, the control centers governing heart rate and breathing are overpowered as well, resulting in death. The immensely destructive nature of this disease has inspired many researchers to look for a cure, but currently, they're focused on slowing its progression. One temporary treatment helps reduce the breakdown of acetylcholine, an important chemical messenger in the brain, which is decreased in Alzheimer's patients due to the death of the nerve cells that make it. Another possible solution is a vaccine that trains the body's immune system to attack beta amyloid plaques before they can form clumps. But we still need to find an actual cure. Alzheimer's disease was discovered more than a century ago, and yet still it is not well understood. Perhaps one day we'll grasp the exact mechanisms at work behind this threat, and a solution will be unearthed.
Okay. I like this because I couldn't understand why losing your mind would mean that you would die. And now with this progression of what they're saying, the last step is that it stops your controller for regulating your breathing. And that is like, oh, okay. What were the two possible therapies they hope will slow down the progression of AD? Does anyone remember? One was a vaccine
Right.
for the plaques to train the immune system to attack the beta amyloid plaques before they clump. And the other one is acetylcholine therapy to reduce the breakdown of the acetylcholine, which apparently we want. Okay. The reason why I put this one, and Sally, I put it back in because it went with a quick history that links these stages of AD with the areas that are affected in the brain. Now we're going to flip to what does this mean for us? Alzheimer's disease impacts the memory, thinking, and behavior that interfere with daily life. It's not a normal part of aging. And that to me was happy news. So let's go to, let's go to, this is, I confused it. What do you have?
Go back to the general screen.
Yeah.
The gallery of all of us.
Okay. Okay. There we go. Okay.
Well, hello, and welcome to the Alzheimer's Association Warning Signs of Alzheimer's Disease. I'm Stephanie Rolfs-Young, the Senior Director of Program Volunteers and Community Engagement, and I'm so honored to be your discussion host today. I am joined by an all-star team of Alzheimer's Association volunteers, including Pippi Rogers, who has been a care partner to her mother, who once experienced Alzheimer's disease herself, and is also now currently an advocate for the Alzheimer's Association, a community educator, and a member of our board of directors in the state of Georgia, where she serves as the vice chair of the board of directors. And Artina Caston, who herself was diagnosed with dementia at the age of 51. And through her advocacy and her work with the Alzheimer's Association, she not only also serves as a member of the Georgia Board of Directors, but she is also a member of the Early Stage Advisory Group and recently joined the National Alzheimer's Association Board of Directors. Again, we are honored to have these guests with us today and so pleased that you joined us. What we'll discuss today are the warning signs of Alzheimer's disease and allow you to hear firsthand what it's like living with dementia. We'll discuss the importance of early detection, how to talk to a doctor or somebody that you're concerned about,
and how to get a diagnosis, and of course, where to turn for Alzheimer's Association resources and support. So as we begin, I think every good conversation about Alzheimer's or dementia starts with understanding the terminology. And as you can see on this next slide, we want to give just a quick high-level overview to these two terms that are sometimes used pretty interchangeably, but mean very different things: Alzheimer's and dementia. So to start with, dementia is a general term for a decline in memory, thinking, and any reasoning skills that are severe enough to interfere with a person's daily life. There are lots of different types of dementias. And in fact, dementia is not a disease in and of itself, but rather describes a group of symptoms that are associated with decline in memory, reasoning, or other thinking skills. When we hear about dementia, we often make the association to Alzheimer's because Alzheimer's is the most common form or the most common cause of dementia. And Alzheimer's is a very specific type of disease, whereas dementia is not. In fact, Alzheimer's is a degenerative brain disease that is caused by many complex brain changes that really are followed by cell damage. It leads to the symptoms of dementia, and in most cases, Alzheimer's gradually worsens over time. Through this webinar, we'll discuss the common early warning signs of Alzheimer's and dementia. And it's so important that all of us are familiar with these 10 warning signs, not only to make sure that we're looking for the signs in ourselves, but also in the people around us, our friends, our neighbors, and our loved ones. As you can see in the next slide, we'll talk about the signs as we want to all be alert to them and be on the lookout for any kinds of changes. The signs that we discussed today do not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes that people experience. And it's important to remember that people may experience one or more of these signs and to varying degrees throughout their experience. In other words, this is not a checklist, and you certainly don't have to have all 10 signs in order to be concerned and to take action if you or somebody that you care for is experiencing any kind of change. And finally, some changes can be due to other medical conditions, so it's always important to talk with a doctor and understand the changes you or somebody else is experiencing. And the sooner you can have that conversation, probably the better the outcome for everyone. So let's talk about the first 3 warning signs of Alzheimer's disease. The first is one of the most common signs of Alzheimer's, especially early on, and that's forgetting recently learned information. In fact, people will say sometimes that their loved one is really good with past memories, things that happened 20 or 30 years ago, but may begin forgetting important dates or events, or repeatedly asking the same question, or even having to rely more frequently on memory aids or kind of leaning on others for things that they once easily remember. A typical age-related change for all of us is sometimes forgetting that one little nugget of information, but most of the time remembering it later. So it's important to distinguish here that we're really looking for recently learned information and how much this may be impacting a person's everyday life. In the second warning sign, we hear often that people will experience new difficulties in executive function, including developing or following a plan, or even having difficulty concentrating. You know, probably many of us on this example today have had an occasional error when you're paying your bills or managing your household finances. But most times you can remember later that you need to do something and you can take that appropriate action. For somebody who's experiencing early stage Alzheimer's or experiencing the symptoms of dementia, it may not be easy to retrace those steps and be able to figure out what it was that you intended to do. And lastly, the third warning sign is that people living with dementia often find it hard just to complete the everyday tasks that used to be so simple. Things like driving to a familiar place, or writing out a grocery list, or even remembering how to play a favorite card game. All of us can occasionally need help using a microwave or using a remote control or even learning new technology. But when any one of these signs begins to happen more frequently or begins to interfere with the day-to-day function of a person's life, that's when we absolutely want to take action. So I'm pleased to introduce to you today Arthena Caston, and I'm going to throw the first question to Arthena and ask you, Arthena, when you were first experiencing some changes, which of these signs did you first notice?
Good evening. Thank you so very much for inviting me. Actually, definitely, I think I experienced almost all of them, almost every single one. It started with something as simple as forgetting how to, a job that I had been going to for 20 years, all of a sudden became something new to me. I couldn't do simple tasks, answer simple questions. And it just got little by little became worse. Soon I had something as simple as I was trying to help plan my daughter's wedding and totally forgot that I was supposed to contact different people to do things, such as having a planner do this, or it just got to be too much. I just couldn't remember. And little by little it got to the point where we had to actually get a professional planner because I couldn't remember.
Mm-hmm. So it sounds like at first they were pretty subtle little changes that any one of us could overlook, but then it sort of started to creep in more frequently. And we hear that a lot of times, right? That people notice little changes and then they start to almost compound themselves. And I'm curious, Pippi, from your experience, being a care partner with your mom, how do you see signs number 2 and signs number 3 being different? Because they really seem very similar on the surface.
They do, Stephanie, and thank you for asking that because I am one of 4 care partners, or was, for my mother. Raising 5 children, my mother was very scheduled and a big planner. So the things were solving problems, simply things like she might find that she's got scheduled 2 things on the same day. For instance, her hair being cut and a doctor's appointment. And she could not seem to be able to problem solve, to just simply make a phone call to make one another day or to cancel one. So she was having issues with that. She also had issues with one of the things that happened was she did things in a certain order all the time when she was preparing dinner. And she, long before she had her own microwave installed, she loved them knowing other people had them. So she always seemed to make something in the microwave. And at one point, she had put something in the microwave and wrapped it in aluminum foil. And she was always very particular about what went in her microwave. And here she was doing something like that. So it definitely is something that showed itself a little bit and then increased in time as she progressed through the disease.
You know, both of you share examples that I think we've heard so many different people say, that at first it's a little sign, but then after a while it's like, well, that really seems out of character for that individual. And I applaud both of you for taking early action to really try to figure out what was going on. You know, as we look at the next 3 signs, signs 4, 5, and 6, I think it becomes more apparent at this point that somebody might have something going on that's not quite their normal baseline. So in the example here with the 4th sign, when an individual living with Alzheimer's or another dementia loses track of dates or even seasons or the passage of time, it might be that they're really having trouble understanding something that's not currently happening, or they're getting a little bit more confused about where they are and how they got there. We see this certainly becoming more dramatic or profound in the middle and late stages of Alzheimer's disease. And any one of us could certainly get confused about what day it is. And over the last year during the pandemic, that has been such a typical experience for so many of us. But understanding that you have a scheduled appointment and then realizing you missed it and figuring out what action to take, those are some of those kind of executive functions that we just talked about that we want to look for a change in. And if you see a change, then obviously we're going to talk to your doctor. We also recognize that some individuals with Alzheimer's or another dementia may experience visual problems or difficulty with balance or trouble reading. Even problems judging distance and determining color and contrast can become a little bit difficult. All of those impact driving or just navigating the environment around them. And while we certainly recognize that vision changes like cataracts are more typical with age, we can easily screen for cataracts and realize if it's a true vision change, or if the change that we're experiencing is more related to dementia or Alzheimer's. And we know that dementia and Alzheimer's aren't just changes in memory, but they can affect the whole brain and how that brain functions in our space. And then lastly on this slide, we often will hear that individuals have trouble following or joining a conversation, or might stop in the middle of a conversation and forget what they were talking about, or find that they're constantly repeating stories. We find that people, as they're living with either one of these conditions, may struggle to find the right word or call things by the wrong name. For instance, I'm sitting in a chair, but somebody might not remember the word chair and struggle with trying to come up with that. So they create a descriptive term to describe the chair. Arthena, I'm so curious. You shared with me one time that reading has just always been a lifelong joy of yours, that you're finding a little bit harder now. Can you talk a little bit about that experience?
I've always, Stephanie, always loved to read. My whole life, I've always loved to read. And now I've got to the point where I can't read anymore. I cannot read, to be honest. I'll just be honest. I have a lot of problems reading magazines or books or anything that would take a long time for me to read. So now, but I laugh and tell everybody I have my Alexa read for me. She reads everything for me. My Audible, well, she does most Audible for me. So I'm not missing all the great books that's coming out because I just put it in my Alexa, and that's the greatest thing that's happened to me. And I love it. I have one in every room. I can read all across my house if I want to and not leave the room. So I love that. That is the joy of that.
That's fantastic. And what a great way to use technology to help you manage. You also mentioned me one time, Arthena, that you were having a little bit of trouble keeping track of the days of the week. And in particular, you mentioned laundry day. So how have you made an adaptation around what you're experiencing with your memory with that?
My worst day, I do have a very bad problem keeping track of what day it is. So what happens is Tuesdays is laundry day in my house. And I have a great husband, a great caregiver. And what he does is on Tuesdays, he pulls the basket out into the laundry basket out into the bathroom for me. So when I go in to take my shower, of course, the laundry basket is sitting right there. And that lets me know that it's Tuesday. Otherwise, we probably would never get our clothes washed or something. I don't know, because I just walk right by Tuesday and don't even think about it. But that is a great thing about having him, because he keeps me on track. And again, Alexa pulls into day then, because I can also ask her what day it is. So I'm just loving that fact that I can, the little niches are helping me all around my house, keeping track of time for me, helping me with recipes, everything. But Tuesdays is the day I always remember, because he pulls that basket out for me every Tuesday morning.
Great way to describe how you've managed to deal with the memory change that you've experienced and still create an experience for yourself in your own home where you're able to function really well. And that's what all of us certainly strive for. As we think about the next signs that come up, signs 7 and 8, we certainly know that misplacing things is a sign that often causes concern in people. And I want to be really clear that this is not just about losing your keys occasionally or misplacing your wallet. We've all done that, and it's so aggravating when it happens. But we generally find that when you misplace something, you can retrace the steps to find them. And that's a really critical element, being able to figure out where you would have left it or used that item last and trace that. A person with Alzheimer's disease or dementia may lose things and may not be able to recall when was the last time that they saw them, or try to figure out where they might have placed them. Or people might start putting things in really unusual places, like putting a pair of shoes in the refrigerator. Because of that lack of executive function that we talked about and changes of awareness, the person may actually grow increasingly suspicious of others or start accusing others of things or putting them in strange areas. So this is certainly a sign that we want to be really attuned to if we see the change in somebody that we care about. And again, on this slide, not everyone experiences some change in judgment or decision making, but occasionally people will say that they feel as if their judgment isn't as good. And especially when it comes to things like dealing with money or paying less attention to their own hygiene or how they keep their house up. Those are kind of the common signs that we often hear about. And that's particularly easy to recognize in people who live alone. They don't have anybody else there watching, and it's pretty easy to get in that pattern. And again, I want to distinguish that we're not overly critical when any one of us makes a bad decision once in a while, like forgetting to get your oil changed on the schedule that you wanted to. But when you start to see these symptoms occurring on a more frequent basis, that's when we really want to raise the alarm and have the conversation with ourselves and with others about what might be underlying these signs. So, Pippi, I'm curious from your perspective, when you were starting to notice some changes with your mom, what jumped out at you first?
Well, making excuses for things. And also, my mother was an avid reader and she was a real wordsmith and she was very social. And she just, things that would have been common sense just weren't there for her anymore. Things such as she did get accusatory. I would say for probably 6 or 7 months. And she had this thing where she would always feel like people were talking about her. And she would do this little, mostly just with family, she would do this little thing and she'd just throw like a little hissy fit and she'd get up and, run in the bedroom and slam the door. And then a few minutes later, she wouldn't even remember that she had done that. And her poor judgment was when she got her car keys taken away from her. And unfortunately, my father did not choose a good hiding place. And she did take the car and she had an accident and could not even reason as to what happened. She just told us that this pole jumped right in front of her and hit her. And so we knew then that, it was time to definitely not just take the keys away, but the car. So yes, it was a hard time, but you did see throughout her disease when she was still verbal that these things continued and they just increased when they happened.
Mm-hmm. Yeah. And Arlena, you shared with us the other day that as you've seen changes in your own memory and you've thought about how your relationship with your husband continues to evolve, you mentioned that you really lean on each other for support. Do you want to talk a little bit about that and how you've been able to have him there as your support?
I tell everybody that, to have a great caregiver is the best thing that could happen to you. And my husband has always been there for me from day one. He is not faltered, not one bit. He is always there. He makes a point to, on Sundays, make sure he takes me out to enjoy life itself. Just even if his basketball game is on, he will take me out. But the best thing about him is that he got me a little job so that I would not be home by myself during the pandemic. And even afterward, he went to the point of going to his supervisor, his boss, and saying, I need to have my wife out of the house. I need her to be around other people. And so he says this, and I know he means it. He says this, he says, I got my wife this job because I want to save her life. He says that all the time. And that means because he wanted me not to be at a place where I was digressing and being lonely. And so I'm telling you, the relationship we have is awesome. He takes me out for ice cream and all kinds of sweets. He would takes me shopping. And I love it. I love it to death. I think this is the best I don't know. I can't say it's the best we've ever been in life, but it's really, really close to it.
Wow, that is so inspiring. And you know, as I think about the relationship that you have, you obviously have been very open with one another. And as we close out talking about the different warning signs, signs number 10, 9, and 10 really speak to how sometimes people aren't very open about this. And a lot of people will describe that it's hard to still stay engaged with family or with social things that you used to like to do. And, you know, sometimes the changes that are related to dementia kind of almost force people to feel like they're starting to lose their interest in following a conversation or beginning to start a new hobby. And you might see people starting to withdraw from those social encounters. So I'm so glad that you've not done that. We also hear oftentimes that people who are living with Alzheimer's or another dementia may get confused or suspicious or even depressed and fearful or anxious about the future. And certainly we know that any one of us have this experience. And you know, again, the last year has really tested all of us in terms of our resolve to stay positive. But it's oftentimes the case that people will say, you know, it's just awfully hard to take the day-to-day and not get upset at home or with a loved one or somebody that I'm familiar with when I'm out of my comfort zone. So Arthena, I'm curious. You mentioned to me one time that it's pretty easy to find yourself withdrawing. Even before the pandemic, it would have been easy to do so. Tell us what it's like day to day and how do you keep yourself positive and focused?
You know, the person I am, when you get to know me, my husband always teases me and says that I'm a person that will talk to a door if they will talk back. He always says that to me. And everybody who knows me knows I'm that person. So when he started finding me at the place where I would look so forward to him coming home, it was almost at the point where I was calling him every day and say, "What time are you coming home? What time are you coming home?" He knew right then something was wrong because I was at the house. I was here by myself. I'm looking out the window every minute of the day and saying, because I'm not tracking with time to know what time he's coming home. And if he was a little late, I would just get so upset. I would get so upset because I was like, where is he? So he got to the point where, you know, he sent me to visit my daughters for a while in Florida. And then he said, that's when he came up with the great idea of getting me the job. And so it started out with a 2-month job. And unfortunately, I'm still at the job. It's been since October. So he's making sure, like I said, he's making sure that I'm being taken care of. He kind of holds me real tight to make sure that I'm taken care of all the time. But at the same time, he is the person that is very honest with me, who's very forthright with me, and is always the person that I can lean on and say, I'm having a problem. Today is not a good day. He's going to be that person and say, what's the matter? You know, I could have asked, I know I say this all the time, I couldn't have asked for a better person, but him being there with me has made me stronger. And it made our journey that we're going with now, not just my journey, but it's our journey. And that makes it all the better.
So important to have a support network wherever you find that and however you find that. And Arthena, I just appreciate your courage for sharing such a personal story and allowing people to see what it's like to live with dementia and what it feels like in the day-to-day. So I'm so appreciative of this. And you know, as we wrap up talking about the warning signs and we start to think about now what do we do? It's so important to remember that these warning signs are just a guide. They're there to help us identify those problems in memory and thinking and behavior that may be related to Alzheimer's or dementia, or maybe something else totally different. And what's important, again, to recognize is that you don't have to have all of these signs in order to take action. In fact, some people have such variance in the signs or may have varying degrees of impairment that it's hard to put together a complete puzzle and really understand what's going on. And sometimes things get better for a period of time or may get worse. And then, you start to question yourself and what you're seeing. Is it really something that you should be concerned about? So we encourage at the Alzheimer's Association that folks have important conversations and discuss any changes that you see in memory, in thinking, or behavior, either in yourself or in someone else, with your doctor. And if you continue to observe these changes, it's so critical that you plan to take the next step and have a conversation with that person or with somebody else who's close to him or her about what you've noticed. So many times it's hard for the person who's living right there in the same household to recognize it because they see it every day. But from a distance, you can recognize that there's a change that is not that person's normal. And when you see that, it's critically important to have that conversation and to be the friend or the family to stand up and say, I know this is a difficult conversation. This may be uncomfortable, but I really want to approach this with you because I care about you. And I want to understand if you're seeing the same thing or what we could do together to get you some support. So I'm curious, from your perspective, Arthena, who really approached the conversation first about the symptoms that you were experiencing at work or with planning your daughter's wedding?
It was kind of a mixed thing with both me and my husband, because I knew something was wrong, especially after I left the car running at work one day. I definitely knew something was wrong. But as I said, I had been going to the doctor. I didn't think he saw it, so because I hadn't gone to him for so long. And every time I would come home and talk to my husband about it, he would say, write it down. But then he kept asking, you're having the same symptoms. You're having the same symptoms. I don't see anything changing. You're getting all this medication. Something else is going on. So we kind of bridged that together. And when we got to that point that we knew, he was there with me when I got the diagnosis. He was the one that was doing all the talking, which is kind of odd because my husband was a very quiet person. But he was doing all the talking and saying, what are we going to do now? That's how, and so I think back to, my daughters knew, or the daughter that was really helping me with the wedding, they knew, but no one ever said anything. It was just like, we're not going to talk about it. But my husband said, there's something wrong. I know something is wrong. So I'm going to kind of give it to my husband as usual. I'm going to give it to him and say, yeah, we need to go to the doctor.
And such a hard conversation to have. Any one of us who has had that conversation, it is so hard to initiate that, but such a critically important conversation. And I'm curious, Pippi, from your perspective, so you were one of many siblings, probably seeing things from a distance. What was your experience like as a care partner when you started having these conversations with your own mom?
Well, she, of course, was in denial, but I'm going to say, Stephanie, that my father was harder to convince than my mother. He was pretty much in denial, and because there were 5 of us, and a lot of it came from my younger sister who lived the closest and would see my parents on a pretty normal basis. It was difficult, but she realized that she was doing things that didn't make sense to her. She would constantly ask, what is wrong with me? And we got to have those conversations. I just wish in 1992, when my mother was finally diagnosed, that there would have been the Alzheimer's Association and the 10 warning signs, and we could have learned a lot sooner about some of the things that were happening with her and been a little bit more proactive. It definitely was something she saw in her own mother, so she could kind of relate to some of those things, and we could have those conversations. She was very open to it, but it was difficult to actually get that diagnosis. So we saw a lot of those signs before she actually got to where she had the diagnosis.
I see.
You know, as you say that, Pippi,
Let me ask a question of everyone right here. Now that we've seen the 10 warning signs, and I'm so glad that she said, you know, don't be worried if you have some of these or all of them. But the best is really yet to come, because now she's going to talk about what to do about this. And we could stop now or watch the remaining, actually there's 2 segments that come now. The remaining ones at our next section. I'll squeeze it in with the others about the upcoming drugs and what people think about them. What do you think? Anybody?
One thing, Laura, is that everybody should be aware there's another 25 minutes if we watch the whole thing now.
Yes, good point. But it's divided up into what to do about it now and what are the Alzheimer's Association resources. And I've put in the chat the phone number, they hit the 800 number, but there is a wonderful brochure, and I can put the, oh gosh, I can't put the URL in, but I could tell you more about it. Any comments? You could put them either in the chat or talk.
Well, does everybody want to hang in for, you know, it's now 11 o'clock. Do you want to still hang in for another till almost noon, or?
Well, no, it'll go to 11:30.
I have my hand raised, Laura.
Okay.
I would make a suggestion that we stop, and I also would like to volunteer some comments, because I come in at the end in terms of diagnosis and my own struggles as a 78-year-old who does diagnosis, and then who's having some memory problems myself and word retrieval problems. And I could add that part if people are interested, and simple things that I'll know if you have some symptoms. For example, everybody here has a clock. Do we all have clocks or watches?
Yeah.
And if you can't draw a clock for me with hands on it, I'll know right away that there's some problem. So I would like to suggest that we do a part 2.
Okay.
Agreed.
I agree.
How does that sound? Let's see. I've got Carter's put in the chat that he would vote for move the rest of it to the next meeting, which is June, not May. And Anne, I see yours also. Vote for the next meeting. And Lorraine, would you?
I would vote for the next meeting.
I agree.
I agree.
Okay, next meeting for me too.
Yeah, sounds better.
Lorraine, are you saying that you would help us with some of that at the next meeting?
Yes, yes.
Oh, okay.
I realize I'm no longer on the committee, but I do have something that might be of value.
Oh, I think so. We'll take you anytime, as you know.
That would be great, Lorraine.
Okay. Well, Rena, how about you?
I say next meeting.
Next meeting? Okay.
I think we've got a majority that want to go to the next meeting. I don't
Yeah.
think we have to poll everybody.
Okay.
So
Well,
that would be in June. Is that correct?
Yes.
so this will be June. May, we're talking about the risks, you know, since it said, oh, all you have to do is watch your diet and exercise and don't smoke and all that. Well, next month, we're talking about the risks. And one of the points that the speaker is going to make is there's dieting, and then there's dieting, and there's dieting for heart health, and then there's dieting to lose weight or to do other things. So make sure you're doing the right kind. I thought this will be a very great talk about the risks that are under your control that you can do something about. But okay, I think I think you'll be happy about the last part of this because after getting you all concerned about the symptoms, that now you can do some more thinking about what you can do about it. So it'll be.
Yeah, this, in my opinion, Laura, this piece has been very good. I think that actually, I would have preferred this over the other two that you included with it. They didn't really add that much to me. This was really information about Alzheimer's.
Okay, well, especially with living with it, as opposed to what's coming up about
I mean, it's
whether or
nothing.
not they think they have done something that will help. Jill, may I ask you to weigh in a second here?
Yeah.
Is this particular one, the warning signs, is it making sense to you?
Totally, but if it's genetic, there's no way of slowing it down or stopping it. There's no cure.
Yeah. Yeah.
My
That's-
husband and his brother both have it. They're both, it seems like all these very intelligent people, they're both attorneys getting it, and they have Parkinson's, forms of Parkinson's with it. And there's just no way to stop it. I've gone to every end of the earth.
Yeah.
Wow.
And it goes back.
Mentioned something fascinating. I had a very dear friend at our church, young man. I think he must have been 52 or 54. And what you just mentioned were exactly what happened to him. It's shocking. And there was nothing he could do about it. He was a physician.
Right.
And so he removed himself from his practice immediately when he learned of his difficulty, because he realized there was no way he could treat patients anymore. And he was still a very young and vital man, but he realized that he was losing his mental acuity.
That along with, I know I have friends too in my support group. We're watching our spouses progress real fast. They're doctors, lawyers, everything. Women that are intelligent, high position. There's just no cure.
No, that's what he found. That's right.
And these, they're on clinical trials and it's not stopping it. They're still progressing fast. It's heartbreaking.
Yeah.
It is.
Life is fragile.
Yeah.
Yeah.
Okay. Well, I think I've got the message. We'll stop here. And thank you so much for.
Thank you, Laura. It's a good
Thank you,
program.
Laura.
Thank you.
Thank you.
Great job.
So Laura, just for clarification, so the next meeting is not going to be around this subject, and this subject is going to be in June. Is that correct?
That is correct. We're on risk factors for diets, and then we come back to finish this, not only with the latest things they think are going to slow it and the contentious views of that. That's why I've made tried to make a point about, check your source. What are they doing? Is it a test? How many people? Anyway, we'll go over some of that, but
thank you.
I'm excited, and I agree. This tape is so wonderful, but if it still doesn't address, like, well, so what have we got? What do we know so far about all the rest of it? So, but it's wonderful, and I'm glad we'll finish. We'll drop the other shoe with what can you do about it, and we'll learn about the wonderful resources at Alzheimer's Association.
And Lorraine, thank you for interjecting your position on this too.
Yes,
That would be
absolutely.
great.
Thank you.
Lorraine, thank you.
Thank you.
Yeah, you're welcome.
All right, wonderful to see everybody. Thank you for helping. This was so good. And I'll see you in 2 months.
Be safe, everybody. Thank you.
Thank you so much. Bye-bye.
Nice meeting you, Jill.
Thank you.
Bye.